I think part of what's going to happen is everyone's going to have to figure out how to get better at managing sicker populations with less resources. We've seen a lot of the health plans that have come into the market struggled with certain programs, and the first thing they do is they go after their insurance agents and they stop paying commissions. And I don't think that that's the right policy.
Welcome to Insuring Growth, where health insurance leaders come together for engaging conversations on policy, education, and business strategy. I'm Brendan McLaughlin, your host and president of E123, the industry's only distribution management system specifically built for health insurance. With over 25 years in health insurance distribution, we help carriers and health plans grow by providing tools, technology, and analytics they need to power smarter decisions and stronger performance. Today, we're welcoming back Jay Davis, co-founder and chief operating officer of Champion Health Plan, a Medicare Advantage special needs plan dedicated to serving individuals with end-stage renal disease. If you caught our earlier episode with Jay, you know he brings deep operational and strategic expertise across Medi-Cal, Medicare, and commercial markets. He's built a model that not only meets the needs of some of the most complex patients in Medicare, but he also proves that doing the right thing clinically can also make business sense. If you haven't already, we recommend going back and listening to our first conversation with Jay earlier this season, where we explored the fundamentals of C-SNPs and the challenges health plans face in serving highly chronic populations. In this episode, we'll continue that discussion and go deeper into the strategies and insights that are helping shape the future of chronic condition care. Let's get back into it. And when we talk to agents, there's 400,000 agents that use our platform every day, and absolutely they want to make a sale. But their business relies on treating and protecting the household, right? The mom, the kid, the grandmother, the grandfather. They want to treat entire, they want to protect entire extended families. And what you're talking about is getting the right person into the right plan at the right time, so it doesn't become end stage. It doesn't become something that's such a big part of their life that it defines them, right? It just becomes something that they have and that's being treated. So I think that's some really incredible thinking. So thinking about those agents and the picture that you just painted to me, I think is really important, because I don't think there's anybody better suited than a kitchen table agent who is in the community, who's meeting people at church or at schools or at functions or coaching soccer teams, right? And actually knows these people. I don't think there's anybody better able to match a person with the plan that meets their needs, right? Than that kind of an agent. But what the agent community tells us is that they need help. They need more than a 1 hour Zoom meeting where a plan is explained. So they're really looking for technology solutions to help them come up to speed with everything that they should know for their members. So when you're thinking about distribution and agents, what sort of technologies do you use, or are you thinking about using to sort of better empower that distribution network?
Well, I think training and engagement. I mean, I think from a technology perspective, I think really from an educational perspective, what we're finding is the ability to come in and have discussions like you and I are having, where we can get into the very specifics about the disease sets. What are the more typical types of obstacles and barriers that they're having in receiving the care, helping them understand what they are, understanding what some of the solutions are, and then the programs, whether they be a human resource within a plan or technology that helps assist with it. From a disease management or care management program, we have a fairly sophisticated population health management tool. Actually, it's an application that we have used in our previous lives and are one of the creators of. Um, and It's called Pop IQ. It basically is an application that ties the provider, our care manager, and caregivers and members have all have access to the same information. It's presented differently to a physician than it is to the member. Um, but really, what we're looking to do is make sure that there's information that is available to people to help them understand what they should be doing um, uh, to find that optimal health is. Um, for some patients, optimal health is controlling my condition and getting on with my life. Others, it is helping them just live the best life that they can live. If you're an ESRD patient and don't qualify for a, a kidney transplant, you're basically on this treadmill for the rest of your life. And so, are we going to make their life? We're hoping we can improve their quality of life and that we're going to help them live the best life that they can live. Versus healthier patients that have manageable conditions that aren't going to put their life at risk immediately. We want to help them find what optimal health looks like. And then finally, for those healthy individuals, because we'll offer a traditional MA plan in 26 as well, individuals that want a program that helps them get to the care that they need from a friendly team and group of qualified physicians within the network. So we'll have something for hopefully for everybody.
Amazing. I did want to talk about your growth strategy. And again, I know I'm not asking for any insider information or trade secrets here, but you've mentioned a couple of times that there are product expansions coming down the road. What else is Champion looking to do in order to expand and grow?
Obviously, we have a variety of very specialized networks in place for these chronic special needs programs. And those programs obviously are one driver of growth. We've got our general MA program that will be coming to the marketplace for 26 through traditional networks. We also work with those traditional networks about how they narrow their networks and find those providers that make sense for some of the more specialized programs. Obviously, individuals with diabetes and cardiovascular disease is a pretty wide open program for traditional networks. When we're talking about our ESRD CKD products, tends to narrow down a little bit more. Our program for the seriously persistently mentally ill gets narrowed down even a little bit more. And so I think, part of it is, again, the provider sales channel engagements, creating the connectivity between the plan, the providers, and the agents, helping people, just like we've talked about, understand the best way to help their clients, recognizing that our products may not be the be all and end all for everyone, but where it is, that we become a go-to solution for our distribution channel.
And so to the FMO owners who are listening, who are really intrigued by what they're hearing, should they be reaching out? Are you looking to expand distribution with new partners, or is that not in the books?
No, absolutely. Obviously, we're looking to bring the right FMO partners on that have the similar kinds of focus and sensibility for purposes of connecting the right plan and the right care to the right beneficiary. And we have a number of large FMOs that are already aboard and excited to get moving with us. But we're open for business, and we would love to hear from you.
Yeah, well, on the program here, we love to make matches. So if that if we can help in any way, we would be thrilled to do that. This has been really great. The one last piece that I really want to dig into a little bit, I think, revolves around the future, but also the landscape of health insurance in the U.S. in general. Obviously, there's a new administration, a lot of changes coming down the road. So as you see the moves that are being made and the ones that are likely to be made, in the coming years, what are the things that you're most interested in, worried about, excited about? What are the things that you think are going to impact Champion the most from a regulatory or from a policy standpoint?
That's a good question. And I will tell you that certainly when you look at serving vulnerable populations, they tend to disproportionately receive extra help benefits. So whether it be Medicaid or extra help for prescription drugs, we know that there's pressure on funding, and so that's going to be pressured as time goes on. Uh, um, uh, we're also seeing the cost of care going up, and so there's pressure there as well. Those are things that concern me. I think from a public policy perspective, we'll have to see what we see with the current administration. I think directionally we know where it's going. Uh, um, uh, uh, I think they will push more heavily towards the private managed care programs like the MA programs. And I think part of what's going to have to happen is everyone's going to have to figure out how to get better at managing sicker populations with less resources. And we've seen a lot of the health plans that have come into the market struggled with certain programs, and the first thing they do is they go after their insurance agents and they stop paying commissions. And I don't think that that's the right policy. We all grow together, we all win together, and if a program isn't going to work, then we all come up with a way to solve some of the problems together. If that means we have to be a little bit more austere on commissions, we have that conversation rather than just take them away. But
There's about 500,000 people I know who agree with you wholeheartedly right there, Jay.
well, we no one does this alone. We may think we do,
Yeah.
but it is a team sport with the beneficiary's best interests in mind, first and foremost. And you start with quality first, and you go down from there.
Yeah. I was specifically wondering, with the administration's and particularly Dr. Oz's focus on value-based care and accountable care organizations, does that, first of all, it sounds like you're sort of well ahead of the pack in that thinking. Is that something that is going to impact Champion as you see it? Is it something that's going to benefit you? Is it something that's going to create challenges?
Well, I think it aligns with the approaches that we're thinking about and have been implementing.
Yeah.
And so when you think about value-based care and you think about the conversation we had about all of our members with a chronic medical condition have a primary care physician, but are probably seeing a specialist that focuses on that medical condition that makes them qualify for that C-SNP product as much or more than the primary care physician. And
Right.
so how you create that value-based approach um, and engage that specialist like they haven't been historically. And that's more the model that we have at Champion is from a not only treating the whole person, but then looking at the individuals who treat that whole person and who's most involved,
Right.
and bringing them into the value-based conversation where perhaps they haven't been part of that conversation historically. They've been the consultant that gets thrown a bone from time to time, but are need to be more engaged.
I am very clearly hearing that engagement is such a competitive advantage for Champion, and it's engagement with the patient, engagement with the providers, engagement with the agents, engagement with the FMOs. It really seems to be very core to your DNA. This is not about sending a memo, right? This is about true engagement.
There's a lot of boots on the ground for what we want to do.
Although that's an interesting question. So you did refer earlier to the frenzy that is the annual enrollment period for MA, and as a C-SNP plan, you don't have the enrollment period. But how does annual enrollment affect your business? Do you find your agents neglect you during these few months? Do you find it difficult to conduct business, or is it pretty much not an issue for you?
Well, I have to now answer that question saying historically, my previous business was the third largest chronic special needs program in the country, a little regional plan, and we had the third largest C-SNP population in the U.S. And what I will tell you is that when AEP came along, we were there with everyone. We were clanging the drum and working closely with the agents. And so that is my expectation for the future. I will tell you, as an ESRD SNP only, too much noise. It really required a very focused approach. And quite honestly, we worked with our agents and FMOs and said, go do your thing, and we'll come back around when the noise is over and focus on this small population of individuals. So about 600,000 ESRD patients in the entire U.S. And so to get anyone to stop and focus on that small of a niche is very difficult. However, when you are looking at talking to masses of people and making sure that Champion Health Plan brochure is in their briefcase is really important. And that's part of the reason why we're moving to expand to a broader portfolio of products, including a traditional MA plan. We want to be at the front, not at the back. And so that's part of the strategy. So yes, on one hand, we have year-round enrollment or on our C-SNPs, but we'll be in the AEP and OEP arena with our traditional plans. And as the agents are talking to prospective members and identifying that, oh, you have a chronic condition, this is important, I have this specialized product for you.
That's terrific. And if you could talk to those agents right now, certainly the ones that are listening to the show, what's one takeaway that you would want them to hear from this conversation?
I think that one of the things that you'll hear is that the customer comes first. Your client, our member, the physician's patient. And that's where all of our focus is on. And oftentimes, I'll hear agents say, how can a new health plan like Champion compete? You can't have the technology. And the reality is, I will tell you that the technology is available, and all plans have a certain level of technology. It is the high touch as well as the high tech that's important. And that clinical staff that is there to provide a concierge service and help them navigate through the complicated healthcare system. It's complicated when you're healthy. It's impossible when you're sick. And really what happens with a plan like Champion is you've got someone who's within the system, will knock down the barriers in the wall to help those patients that need the most help get a very personalized service.
And a big thank you to Jay Davis for joining us again on Insuring Growth. It's been a real pleasure having you back on the show.
Thank you. I've enjoyed the conversation today.
It's been a real pleasure having you back on the show. And thanks to all of you for listening. We hope you've enjoyed this follow-up episode and the continued insights into chronic condition care and the evolving role of C-SNPs. Make sure you're subscribed to Insuring Growth, the podcast by E123. We've got more episodes coming your way this season featuring top industry leaders, innovators, and policy experts, all helping to shape the future of health coverage. I'm Brendan McLaughlin, your host.